Hello everyone, thanks so much for joining me today. My name is Lydia and this is Time with Lydia the Pharmacist. Today I'm going to be spending some time with you talking about a very common eye condition. And this is a condition that we see a lot of in the community pharmacy, and it is known as conjunctivitis. Some people call it pink eye. So one may ask, what is conjunctivitis or a pink eye? Conjunctivitis is an inflammation or infection of the transparent membrane, which is also known as the conjunctiva, that lines your eyelid and covers the white part of your eyeball. When small blood vessels in the conjunctiva become inflamed, they are more visible, and this is what causes the whites of your eyes to appear reddish or pink. Conjunctivitis can be caused by so many different things. It can be caused by a virus, a bacteria, or can occur as a result of allergies. It can also be caused by a chemical splash in the eye or a foreign object in the eye. In babies, conjunctivitis would occur as a result of an incompletely opened tear duct. Bacterial and viral conjunctivitis are easily spread from person to person, but allergic conjunctivitis is not contagious. Viral conjunctivitis is the most common type of conjunctivitis. This type of pink eye is very contagious and often spreads through schools and other crowded places. It usually causes burning, red eyes with a watery discharge. Viral conjunctivitis is usually caused by the same virus that causes runny nose and sore throat in people with the common cold. It usually clears on its own within several days without medical treatment. Bacterial conjunctivitis is also very contagious. An infection from bacteria causes this form of pink eye. With bacterial conjunctivitis, you have sore red eyes with a lot of sticky pus in the eye. Some bacterial infections, however, may cause little or no discharge. Sometimes the bacteria that cause pink eye are the same that cause a sore throat. If left untreated, can cause serious damage to your eye. And now allergic conjunctivitis. Allergic conjunctivitis is a type of pink eye that comes from an allergic reaction to pollen, animals, cigarette smoke, car fumes, or something else in the environment. It is not contagious. It may be seasonal or flare up year-round. Allergic conjunctivitis makes your eyes very itchy, red, and watery, and the eyelids may get puffy. So now, how do you get conjunctivitis? Bacterial and viral conjunctivitis can be quite contagious. The most common ways to get the contagious form of pink eye include direct contact with an infected person's body fluids, usually through hand-to-eye contact. Spread of the infection from bacteria living in the person's own nose and sinuses. Also, not cleaning contact lenses properly or using poorly fitting contact lenses or decorative contacts. Children are the people most likely to get pink eye from bacteria or viruses, and this is because they are in close contact with so many others in school or daycare centers. Also, they don't practice good hygiene. There are quite a few symptoms that can make you aware of the fact that you're suffering from conjunctivitis. And the most common pink eye symptoms include redness in one or both eyes, itchiness in one or both eyes, the feeling that something is in your eye or a gritty sensation in your eye, a discharge in one or both eyes that forms a crust during the night, and this may prevent your eye or eyes from opening in the morning. This occurs usually with bacterial conjunctivitis. Sometimes burning, painful eyes, watery eyes, puffy eyelids, blurry or hazy vision, or being extra sensitive to light can also occur. Just take note of the fact that you would have to see your doctor immediately if you have pain in your eyes, if you have extra sensitivity to light, or a disturbed vision when the redness is intense in one eye or both eyes, or when it's a newborn baby with conjunctivitis. So now, what is the best treatment for conjunctivitis? Treating conjunctivitis or pink eye usually depends on the type of conjunctivitis you have. If conjunctivitis is caused by a viral infection, there are no specific treatments. Your body fights the virus on its own. Placing a cool, wet washcloth on your eyes several times a day can help make them feel more comfortable. If your pink eye or conjunctivitis is caused by a bacterial infection, your ophthalmologist or your doctor or your community pharmacist may prescribe antibiotic eye drops depending on how severe your symptoms are. Antibiotics do not treat an infection caused by a virus or by allergy. If your conjunctivitis is due to allergies, you might be told to use certain eye drops to help with the itchiness and puffiness. Over-the-counter eye drops that contain antihistamines or anti-inflammatory medications also may be effective. Speak to your pharmacist for advice. Sometimes conjunctivitis can be caused by a chemical or other substances in your eye. In this case, rinse the eye free of the substance. You might be told to use certain eye drops or ointment for the eyes. And if you wear contact lenses, you will be advised to stop wearing them until treatment is complete. Conjunctivitis usually goes away on its own within 1 to 2 weeks. If symptoms last longer than that, then you should see your ophthalmologist. He or she can make sure you don't have a more serious eye problem. How do you stop conjunctivitis from spreading? Viral and bacterial conjunctivitis can spread from person to person. So follow these tips so you will not infect other people or reinfect yourself. Tip number 1, use a clean towel or tissue each time you wipe your face and eyes, and do not share towels and washcloths. Tip number 2, wash your hands very often. Always wash them before and after you eat, when you go to the bathroom, and after you sneeze or cough. Tip number 3, try not to touch your eyes. If you do, wash your hands right away. Tip number 4, bacteria can live in makeup. This can cause pink eye and even a dangerous infection of the cornea. So do not use eye makeup while your eyes are infected. Replace your makeup if you have an eye infection, and never share eye makeup with others. Tip number 5, change your pillowcases often. And finally, tip number 6, make sure you clean your contact lenses exactly as your ophthalmologist recommends. I hope you have learned something today. Please give this video a thumbs up, share with family and friends, and remember to leave your comments in the comment section. If you haven't yet subscribed to this channel, I would be really grateful if you hit on the subscribe button and also on the notification bell, so you will be amongst the first to see any video that I upload. Thank you once again for your time today, and I hope to see you soon in my next video. Bye for now.